As cancer was covered generally in Nursing 3100, I wanted to give you just a few specifics about oral, esophageal, and GI cancers, along with traumas that may affect some of these areas. So I will record this in a couple of sections, probably just to hit some of the highlights from your book on these subjects. So you can kind of see oral cancer and esophageal cancer's epidemiology. Men are affected 2 to 4 times more than women. That tends to be because they have lifestyle choices and or work environments that lend them to be more out in the sun, where their lip may be exposed and develop cancers from sun. They tend to be much more commonly associated with use of smoking, as well as much more a primary user of chewing tobacco. You will see in the GI system overall, in the upper portion, you tend to see squamous cell carcinomas that grow rapidly and metastasize, and these affect the oral area as well as the upper 2/3 of the esophagus. And then the lower 1/3 of the esophagus tends to be more likely to be adenocarcinoma, which is a different type, and it is also found in the lower GI tract. Areas that you may see affected in the oral cavity can be the lips, the tongue, the buccal mucosa, the floor of the mouth, hard palate, upper and lower gingiva. And then through the esophagus, it can be throughout, but different types depending on the location generally. You will notice that the death rate from esophageal cancer in 2013 was 15,210 people, which is not a huge number, but look at the big variation between men and women. So there is a huge more risk situation for men versus women for these type of cancers. The causes generally tend to be smoking or oral use of tobacco products, exposure to the sun. As many men, have jobs where they've worked outside a lot more, they tend to be more susceptible to that type. But half of the cases of squamous cell cancer in the esophagus are associated with smoking. And then chronic gastric reflux can also cause some issues with cancer development. I know we've looked at lots of mouth pictures related to stomatitis and candida and all different other kinds of infections of the mouth. So in general, you will see, some of these same white patchy areas, and a type of cancer that creates that color is leukoplakia. You may see a mixed with some white and some red, or you may see this erythroplakia, which is really a pretty bad sign. It's kind of uncommon for us to see that red of areas in the mouth. So anytime you do an oral assessment and you find that the patient has things in the mouth that are not normal like this, they need to be reported, and the physician needs to come and assess it just to make sure what we're dealing with, if it's an infection, if it's a inflammation, or if it's actual cancer cells that are growing. Oral cancer will manifest itself often with oral bleeding. Usually these are more on the floor of the mouth or the tongue in the beginning. You may see raised areas on the lip or in the mouth. You may have oral ulcers. Instead of them looking round like you see with like your typical little ulcers that you get from herpes simplex, you will have really irregular margins and borders, odd shapes, raised areas, and they can be either white or red patches. And you will sometimes have radiation of pain from those areas up to your ear or your neck. They may have difficulty speaking because of the growth or the pain. They may have trouble swallowing if it's further in the back of the throat. They may have trouble chewing. They may have an oral feeder or a bad odor type thing that comes from this that you can easily smell. They may have lymph nodes in the throat, neck that become inflamed, and usually appetite may be poor and weight loss occurs. And then sometimes because of some unusual shapes or serious pain problems or irritation areas, their dentures may not fit well, or they may avoid using them because of the discomfort. In terms of esophageal cancer, usually the most common symptom is going to be this progressive inability to swallow or difficulty swallowing. The sad thing is, for esophageal cancers, patients will be usually asymptomatic until it has grown to the point where it's 50% of the esophageal lumen, and Mets are usually already in place to either the lung, liver, bone, stomach, cervical nodes, or other sites. And because of this finding at a very late time frame, the overall 5-year survival rate ranges from 5 to 30%, so it's very poor, and that's even with treatment. Symptoms, you will, of course, in addition to dysphagia, you will have problems with hemoptysis and coughing up blood. They may have pain, burning sensation in the middle of their chest, painful swallowing as food or fluids get to the tumor site. So it's fine in the beginning, but when it reaches that point, they'll have a lot of discomfort. They may have vomiting, weight loss, anorexia. Hoarseness is a very, very common symptom as well that comes about, and then they may have melena. So for treating oral cancers, it really depends on the size, the stage, whether there's metastasis present, and then often a physician is going to really look at what is their current potential functional level, because if they just don't have much function in life at that point, they may not be able to really deal with the nutritional deficits, the pain, the problems that go along with the treatment for this disease, because many times nutrition has to be completely altered to a different method because of the location. You may see them receive radiation therapy as either primary or secondary, meaning that they might use radiation to just really treat the cancer itself, or treat it first to shrink down a tumor, and then they also may use it following chemotherapy or surgery to just make sure that additional cancer cells are killed. Many of these surgery treatments can be, just involve some small lesions under local or general anesthesia if they're found early. If not, they may have more extensive surgeries. Sometimes it may affect, even large portions of their upper palate, their face, and create some serious areas that make plastic surgery very difficult to manage. And so because of that, again, you have to look at the patient's functional level and what is the type of surgery going to benefit the person. For some small lesions, they can do like what's called a carbon dioxide laser. They can do cryotherapy to kind of freeze the lesion and off, and then there is also something called photodynamic therapy that can be a treatment for it. For management and treatment of esophageal cancer, as we stated in class, you're going to do a barium swallow. That's just to give you an idea of what does the actual flow look like in the esophagus. CT scans will also be used to look at that. They also will be used to look at different parts of the body where Mets might be common, to make sure that they determine whether it's metastasized or not. And then they can also do a full body PET scan to look for even small areas of where metastatic cell growth is going on, because they want to know all that before they decide on the treatment regimen. They can do endoscopic ultrasonography that will give them a better location and breakdown, because it can distinguish between normal and abnormal tissue. They can do a thoracoscopy or a laparoscopy and use instruments to kind of go down into the area to take out tumors or growths. Many patients, because esophageal cancer is experienced so late, will go to use different kinds of complementary and alternative medicines, and those are just a listing of quite several that are used that can help many patients just to relieve pain. Because it's really rare that esophageal cancer is discovered early, surgical management is really just primarily for the rare instances when it's found really early, but if it is early, it can be curative. And in that case, they take out the tumor and surrounding nodes or tissue just to make sure that they really have gotten all of it. There are some cases also when somebody has the growth not operable that's in the esophagus, and it may be constricting an area. They may have some other surgical interventions to kind of get that the narrowed opening to be expanded or dilated or opened up to a degree, just to allow the person from a palliative standpoint to be able to eat and drink for a longer period of time. Complications that you may see with oral cancers: it often will infiltrate to the muscles and the underlying tissue, and this can affect the muscles throughout the face and in the throat, depending on the location where it starts. Some patients will have to have surgeries that really leave them terrifically disfigured in their face. They sometimes can lose an eye from oral cancer because it has extended that far. So it's not a easy one to deal with from that standpoint. And it can affect their ability to eat and talk. Esophageal cancers, of course, have swallowing difficulty, but it's often because there's a stricture. If they have done surgery and put the site back together, then they may have scar tissue or strictures from that, or they may have just the lesion itself is growing and creating that problem. They're commonly known to have heartburn because of the pressure loss. They also will have nausea and vomiting because their stomach's not emptying very well. And of course, they have potential for bleeding and rupture as well. In terms of trauma of the upper GI system, major causes are usually injury to the bones of the face, the nose. Sometimes diagnostic procedures that are done can result in negative outcomes. So just for example, a diagnostic endoscopy going down into the esophagus has a complication rate of 0.1%, which is not real high, but with just therapeutic endoscopy procedures to kind of open up something, you can have a much higher complication rate. And that's because the structures are already more susceptible to break loose or have problems with the tissue strength in the area that you're scoping. There are very, very high mortality rates with esophageal perforation, so if that occurs, you can see some of that. If it's found, it needs to be treated as fast as possible, and the mortality rate can be 30 to 50%. Other things can be caustic substances, blunt injuries,